Here's a question that was sent to me by email, and I edited out the name. I have some damage resulting from a prolonged erection, or priapism, that probably happened, I'm guessing, from taking Viagra or Cialis. Anyway, from a prolonged erection that I had to receive emergency treatment. And by the way, that usually means you go to the ER and they put a big needle and just drain your penis like it's a water balloon or something. I have received 2 rounds of the priapus shots. First round was around May the 28th. The next was around the end of August. I received both from the men's clinic in Memphis, Tennessee. I am very pleased with the results. It seems that the scarring that I could detect on the right side of my penis has almost gone away, and I also have noticed at least an inch increase in length. My ED has not gone away, but not near as severe. I have a couple of questions. First, should I receive more rounds of the priapus shot? They do seem to work. And should I be on a daily dose of Cialis to help with the ED? Thanks for your time and your work. Truly believe you're onto something. You're welcome to use my testimony, and if you ever need a patient to teach your procedure, I will gladly volunteer. I am not at all shy, and it would help reduce the cost. Looking forward to hearing your advice. I will always leave my phone number. I will also leave my phone number if you need to call. And of course, I edited that out and copied this because this has a lot. It's a very good question. It has some questions that I receive often. And here's sort of an outline of what I was thinking. First of all, as far as multiple procedures, should you have more, let me introduce you to some research. If you click on our Peyronies disease link, and you go and you see what I did to come up with this is I just reviewed the literature for everything that I could find that was relevant for the past 20 years, and then looked at what was most proven. And what seems to work best is a combination of therapies. Then, as far as the priapus shot goes, if you look on our research page, there's been one paper so far by Dr. Varag, who was a pioneer with Trimix, and he put out a paper in French about using platelet-rich plasma. Now, Dr. Varag, that's the textbook that I reviewed and read all of that and most of the references. Let's see, here we go. Platelet-rich PRP for Peyronies disease. And here you'll see Dr. Varag's paper. It's in French, but there's an abstract here in English. And I've met Dr. Varag, very brilliant physician. He started doing research with the Region Company after I introduced the procedure. And so because this is a research protocol, it may be done a little differently, perhaps, than in the clinic of the community. Now, this is just my opinion about his research. Very brilliantly done. And what he showed with this research, that multiple treatments, and this is using a region tube, using multiple treatments. So they were treated, 13 patients, 8 with curvatures of over 50 degrees. That's pretty severe. Were treated during 2 months with 4 sessions of injections. So he does so that's 8 weeks, 4 sessions about 2 weeks apart. Now, since then, I saw him present new research, I don't think it's been published yet, where he compared using the priapus shot methods with doing collagenase, which is very expensive, and has about somewhere between 2 and 5%. So 1 in 50 to 1 in 20 go from a curved penis to a limp noodle because it causes fracture of the penis, because the collagenase is basically a chemical way of doing surgery on the area of scarring. And if it dissolves too much of the fibrosis, then it causes inability to have an erection. which we have not seen with PRP alone. PRP has never been demonstrated to cause damage. Not saying it can't happen, but if it happens, it'll be the first time in over 8,000 research papers. Now, Dr. Varag include a hyaluronic acid because in Europe, as opposed to in the States, the Region kit comes with PRP and you activate it with a hyaluronic acid, which is similar to Juvederm, or it's like a Juvederm-like material, or a liquid collagen. In the States, I don't use this. I think it adds to the risk of granuloma formation. Using Juvederm alone is a 1 in 10,000 chance, so very, very low, but a 1 in 10,000 chance of causing granulomas. So we use the platelet-rich plasma alone. The point is that he did this every 2 weeks. In one study, he went every week, but the people are they are perhaps not paying as much because the study is covered by a region. Where if someone's paying out of their pocket, if you look at so we don't really know what the ideal interval is. But if you look at the soft tissue research in wound care and healing scarring, where you can see it in the face, acne scars and such, and that research has been done, what you see is the ideal time between treatment seems to be 4 to 6 weeks. And complete, absolute, full effect is around 12 weeks or 3 months. If you look at orthopedic procedures, the full effect seems to be 6 months to a year. It's a slower healing tissue, less blood flow than in skin and soft tissue of the face, and we would assume of the penis. So we don't know the ideal times or intervals. What I tell people is my observation and on the face is that you don't really have full effect until 12 weeks, but probably have 80% of what you're going to see by 8 weeks. And since people are in a hurry to get well, I recommend people give it around 8 weeks between procedures, maybe 6 weeks if you're in a rush and you've already seen some improvement. Now, if someone's not seeing improvement, then they're not seeing improvement. So at 8 to 12 weeks, by 12 weeks, if there's no results, maybe do one more, and at 12 more weeks if there's no results, then it's probably not going to work. There's something else going on. All of these ideas should be included as much as possible into the therapy, not being overzealous with the pump, because being overzealous with the pump or the traction can cause an erectile dysfunction, but keeping it around 10 to 20 minutes twice a day at a pressure of less than 10. So back to this question. First question was, they do seem, should I receive more rounds of the priapus shots? Yes. I would say as long as it's working for you, space them out around 8 to 12 weeks apart and repeat them until it quits working. Should I be on next question, should I be on a daily dose of Cialis to help with the ED? This is kind of tricky because you think, well, if I need the Cialis, what's the use of the priapus shot? The point, I would use it if you need it, and for 2 reasons. First of all, if you go back, just talking about the Peyronies disease or the curvature that you had, the scarring and the curvature and the loss of erectile dysfunction from this priapism. And that's what we're talking about, damage and scarring from prolonged erection, which caused necrosis. So you're trying to restore that. The priapus shot is ideal for that because you know the damage is in the area of the penis. Now, let's say that there's also other problems. People are complicated. Sex is not just one thing. There's a whole sex system, right? There's hormones, there's neurology, there's psychology, there's mechanical things. For example, there could be an obstruction of the blood flow from the aorta to the penis. And if that pipe is clogged, then this person may need some sort of stent or balloon procedure to open up that blood flow. Or perhaps prolactin is too high, or estrogen is too high, or testosterone is too low. or maybe he's taking a blood pressure medicine. So it's not this simple. But on the other hand, if you want to think just in terms of the tissue of the penis itself, if you go back to this research about Peyronies disease, in that textbook that I showed you, that you can see here, you'll find that there was some research, Cialis or in combination, helps with Peyronies disease. And a low dose is used daily to help recover the penis after prostate surgery for two reasons. If you read this, the theory is that it maintains blood flow, so it helps with the healing process. And number two, there's a biochemical reaction that goes on that could help with the healing in a method different than just increased blood flow. So my philosophy has always been do as much as you can to get well. And then after you are well, keep doing everything and drop off one thing at a time to make it as simple as possible. So why, instead of doing one thing at a time? So with this recovery of the penis, we know with penile rehabilitation, the therapy is a daily pump, penile rehabilitation post-prostate surgery. It's a daily pump, penis pump, and daily low-dose Cialis, and we have now added the priapism shot to that method. So here's damage that wasn't prostate surgery, but here's a damaged penis that is working better. He's grown, it's better, but he wants it to be even better. So I would go back and do everything on this protocol. I know this isn't Peyronies disease, but everything that applies to recovering the Peyronies disease penis would help recover a penis just from erectile dysfunction or post-prostate surgery or post-priapism. So I hope that helps, and please leave comments below. I'll send this also to our physicians so they can comment. And thank you very much, sir, and I'm leaving out your name, but thank you so very much for your bravery and offering to give a testimony. If you want to do that, you can actually do that and still keep your name out of it by just going to reviews. I think, understandably, and you can see there's 245 posts here, understandably, people have been taken advantage of when it comes to the penis. I mean, imagine having a 2-inch erection. It could be difficult to have a normal, your options may be decreased, at least in that area. And so men have been desperate when it comes to erectile dysfunction because it's not just about pleasure, right? It's about relationships and love and family. So I recognize that pain, and men have been taken advantage of. If you put your name here, that's wonderful, and I'm grateful, but I have found that some people are almost ferociously aggravated that we seem to have something new and that's working. Because they've been taken advantage of so much, they're prone to criticize and attack. So I won't call you fearful if you leave your name out, but putting it in would also help lead credibility to your story. So thank you again for your question, and hopefully we'll get some comments from some of the other providers. We have urologist Dr. Bano that I mentioned here, is a urologist out of Chicago, professor there, who just teaches urologists how to do penile implants. And there's still a place for that. Eventually, if once someone has diabetes or some sort of problem that just takes away and the priapism shot doesn't work, Cialis doesn't work, Trimix doesn't work, there's still a place for a penile implant, and 90% of men who get one are happy with it. It's only 1 out of 10 are not. Dr. Bano is an expert. He's just a wizard at that, teaches other doctors how. And he just presented a paper about how the priapism shot helps with venous leaks and increases arterial pressure of the penis. And that was presented at one of the recent sexual medicine meetings. Let's see, what else do I need to mention here? and be sure and do the whole protocol. I think that's it. So have a wonderful day, and please keep us informed about your progress.